Welcome to What Your GP Doesn't Tell You, the podcast for both doctors and patients with me, Liz Tucker. This week, I'm talking to psychiatrist Dr. Anna Lembke about the role of dopamine in food addiction. This is the second podcast of 3 that I'm doing in conjunction with the International Food Addiction Consensus Conference that was held in London on the 17th of May. Each features a different speaker from the conference. In her conference presentation, Anna argued we've transformed our world into a place of overwhelming abundance, where we're constantly bombarded by high reward, high dopamine stimuli, whether that be social media, drugs, gambling, or food, all of which can cause our dopamine levels to rocket. She says we're becoming addicted to pleasures that make us sick. Anna discusses the neuroscience of addiction and the impact of these relentless dopamine hits on our brains, the value of a month-long dopamine fast, and what we can all do to lead healthier, more balanced lives. But before we get to Anna's interview, a brief request from me. If you enjoy this podcast and would like to leave a review on Spotify or Apple, that would be much appreciated. It really helps. You can also become a paid supporter of the podcast at patreon.com/whatyourgpdoesn'ttellyu or via PayPal on my website, whatyourgpdoesn'ttellyu.com. A huge amount of work goes into both the research and production of this podcast, so even a small amount of money makes a huge difference. And you can find out more information about the pod on my website, where you can sign up for the podcast mailing list, follow me on Twitter at Liz C. Tucker, and on my Substack account, liz.tucker.substack.com. Many thanks. And now back to Anna's interview. Dr. Anna Lembke is a professor of psychiatry at Stanford University School of Medicine and chief of the Stanford Addiction Medicine Dual Diagnosis Clinic. She's published more than 100 peer-reviewed papers, book chapters, and commentaries, and is also author of the book Dopamine Nation: Why Our Addiction to Pleasure is Causing Us Pain, published by Headline. Anna sits on the board of several US, state, and national addiction-focused organizations. Here's her interview. Well, hi, Anna. Thanks so much for joining the podcast today.
Thank you for inviting me. I'm delighted to be here.
Anna, the subject you're talking about at the conference is the role of dopamine in food addiction. And I think a lot of people will be skeptical of the idea that eating too much or eating the wrong food is an addiction compared to, say, drugs or alcohol.
Yeah, let me see if I can combat some of that skepticism. I think, if you look at the phenomenology of addiction, that is to say, the natural history of how it begins and how it progresses, what we see is that people start out using drugs and alcohol for, broadly speaking, one of 2 reasons, either to have fun or to solve a problem. If it does that for them, then they're likely to return to using that drug. And what we know about the neurobiology of intoxicants and highly reinforcing substances and behaviors is that over time they change the brain such that what used to be reinforcing becomes less so. The individual then needs more potent forms and in larger quantities to get the same effect. And ultimately, the brain kind of gets the message, hey, stop making your own endogenous dopamine because you're flooding the system here. So people end up in kind of chronic dopamine deficit state. Dopamine is our reward neurotransmitter. We release dopamine at baseline tonic levels. And what happens with repeated exposure to, traditional drugs, including alcohol, is that the brain kind of ends up in this chronic dopamine deficit state. And that state looks a lot like clinical depression, clinical anxiety, intrusive cravings, thoughts of wanting to use, mental preoccupation with the drug, inability to stop using the drug even when one wants to. And then ultimately, kind of the sine qua non of addiction is continued compulsive use despite consequences. There's a classic identifiable brain change that's been well documented in both animal and human studies. So then the question is, well, can people get addicted to food? Does food release dopamine in the brain's reward pathway akin to drugs and alcohol? And the answer is a very clear and resounding yes. So, for example, we have human imaging studies showing that sugar causes a key part of the brain called the nucleus accumbens, which is rich in dopamine releasing neurons, which is part of our brain's reward circuitry, to light up. So that is definitive evidence that sugar releases dopamine above baseline tonic levels. In other words, it works on the brain very similarly to drugs and alcohol. We have evidence that other, especially processed foods, do the same. What do we mean about processed foods? We mean, especially when we're combining things like sugar with salt, with fat, with carbohydrates, with flavorants.
So these are particularly the sort of ultra-processed foods.
That's right. The foods that essentially have been drugified to be more reinforcing, which is another way of saying foods that release dopamine in the brain's reward pathway. And then if you look at the phenomenology of people's relationships with food, what you find is that especially in the last 50 to 100 years or so, as food has become more plentiful, as food has become more processed, as food has become more flavorful, and created intentionally to be highly reinforcing, we are seeing across the population more and more people who simply cannot stop eating, even when it is threatening their lives, threatening their livelihood, threatening their relationships.
But I suppose, Anna, the word addiction is a very particular word, isn't it? And I think when one uses the word addiction, you imagine people not being able to perhaps go to work, perhaps committing crimes to fund their habit. Is that happening in food addiction?
It is. I mean, maybe the crimes piece is a bit of a stretch. And by the way, when we look at crimes being committed in the service of addiction, we're typically looking at people who are addicted to illegal drugs. So by definition, they are engaging in crimes when they consume. But more harm on the planet is probably caused by legal drugs like tobacco and alcohol. And those are seldom associated with criminal activity. Alcohol is an exception because it causes, mental status changes such that people drink and drive and engage in other antisocial behaviors. But tobacco is a great example.
Sure.
Of something that I think we could all agree people get addicted to and is very seldom linked to criminal activity. But in terms of harming lives, it's very clear that like other drugs, people can get addicted to food to the point where it is taking over their lives and causing really significant problems. And I'm not just talking about the problem of obesity, because of course that is an obvious health issue, especially in its most extreme forms. But we are seeing more and more people who use food like a narcotic. So they binge eat until they essentially pass out. In many instances, these individuals are normal weight. You would not know that they had a food addiction if you just looked at them. And that's, by the way, also not to say that all people who are obese have a food addiction. Those things are not necessarily linked.
Sure.
But just to give you an example, a patient, a college student who had a very serious food addiction, where she would use food essentially the way that people binge drink on alcohol, and she would binge on food until she passed out. And then she would pass out sort of for days at a time and not eat. So she was normal weight. You would not have known looking at her. But it was a very significant problem in her life. It took up all of her mental energy, her time, her creativity. She wasn't really able after a while to go to class or participate in any kind of meaningful social life. She was depressed. She was anxious, which are typical sequelae of any addiction. And she repeatedly tried to put barriers in place to try to stop the behaviors, and yet none of those barriers were sufficient. So let me just give you an example. She told herself, okay, I'm not going to buy food anymore, because she would DoorDash or order food in the dorm and binge on it. She said, I'm only going to binge on the food that I can find on campus. So she would wander around campus looking for free food. There's lots of free food on many campuses, so she would binge on that. But ultimately, when she couldn't find free food on campus, she would eat out of garbage cans.
Wow.
So clearly, we have passed some kind of threshold. And, and she was fully aware that the behavior was not healthy. She wanted to stop. At one point, she thought, well, if I don't have any shoes, then I won't be able to leave my dorm room to wander campus to binge on food. So she locked all of her shoes in a safe. And then within 24 hours, she had ordered new shoes from Amazon.
And clearly, anyway, not a terribly practical long-term strategy.
Right, right. But you see the extremity of the behavior, you see the desperation.
Yeah. And I'm interested, Anna, because you said that ultra-processed food was one of the things which can be a factor in food addiction. And given that those of us who live in the US and the UK eat a lot of ultra-processed food, so are you seeing more patients with food addiction now than you saw when you first started practicing psychiatry?
Over the past 20 to 25 years, we have seen growing numbers of individuals who present with what I'll just broadly call disordered eating, who are not fitting the classic criteria for an eating disorder, which is very often linked to a kind of body dysmorphia or a desire to be thin. What we're seeing is more and more people who really are using food as a drug, as a way to numb themselves, to escape their feelings, to check out, to sort of narcotize themselves. The main thrust here that I would like to communicate is that one of the biggest risk factors for any addiction is simple access to our drug of choice. So we know that if people grow up in a neighborhood where drugs like cocaine and heroin, cannabis, and what have you are sold on the street corner, they're more likely to use them and they're more likely to get addicted to them. And the same is true for food. We have now not just an abundance of food in wealthy nations, but we have a drugified food supply. The food has been engineered to be addictive, to make it very difficult to stop eating once we begin, because it's not just fulfilling a nutritional need, it's also releasing dopamine.
And can you explain, Anna, exactly what dopamine is and what its role is in addiction?
Yes, dopamine is a chemical that we make in our brains. It is classified as a neurotransmitter. Neurotransmitters are the molecules that bridge the gap between neurons. Neurons are the long, spindly cells that conduct electrical signals, that create the circuits that make us who we are. But neurons do not touch end to end. There's a little gap between them called the synapse. And that gap allows for fine-tuning control of those electrical circuits. Neurotransmitters are the molecules that bridge that gap that allow for that fine-tuning control. So, for example, a presynaptic neuron will conduct an electrical signal, which then causes the release of a neurotransmitter like dopamine from the presynaptic neuron, which then crosses that gap, binds to a postsynaptic receptor, and then can either give the signal to continue that electrical impulse or to inhibit the electrical impulse. Through this method, neurotransmitters essentially are the conductors of the neurological symphony. Dopamine is essential for the experience of pleasure, reward, and motivation. It is not the only neurotransmitter involved in that process, but it is the final common pathway for all reinforcing substances and behaviors. And we have a dedicated circuit in our brain called the reward circuit that is especially prominent or important in telling us what we should seek out more of, explore, approach versus what we should avoid. And when we do something that our brain considers vital for survival, it releases more dopamine in the brain's reward pathway, which feels good, which then makes us want to do it again. So we're always releasing dopamine in the reward pathway at a kind of baseline tonic rate. But when we do something that's pleasurable or reinforcing, that increases dopamine above baseline levels, that feels good. And then we want to do that again. On some very basic level, we're very simple creatures. We reflexively approach pleasure and avoid pain. And that is on some very simple but deep level guiding everything that we do. We're always doing these micro assessments. Was that pleasurable or was that painful?
And dopamine is a useful measure of any addiction.
Yeah. So, there's been an explosion in research in the last 75 years on dopamine. It was discovered in the 1950s as a human brain neurotransmitter. And since then, it's become a kind of common currency for neuroscientists to measure the addictive potential of any substance or behavior. The more dopamine that's released and the faster it's released in the reward pathway in response to substances or behaviors, the more likely that substance or behavior is to be reinforcing, something the organism will do again, and or addictive. let me emphasize that dopamine, again, is not the only neurotransmitter involved in that process. We have many other hormones and neurotransmitters, like our endogenous opioid system, like our endogenous cannabinoid system. We make our own cannabis, like our endogenous serotonin and norepinephrine systems. Oxytocin, our love hormone, is involved in that process. So it's a complex cascade. But if you were going to reduce it down to its very simplest components, you look at dopamine, because the idea is that the final common pathway for all of these chemical cascades is to release dopamine in the reward pathway.
So basically, it's a useful marker. Any potentially addictive behavior I was to indulge in, whether that be gambling, drink, or drugs, would drive up my dopamine levels.
Yes, and not just any addictive behavior, but any reinforcing behavior or pleasurable behavior. For example, playing the piano, learning certain types of flow states in terms of work or creative endeavors, meditation practices, prayer. These have been shown to be able to release dopamine. So it's not just intoxicants. What distinguishes intoxicants is the amount of dopamine released and also how quickly it's released.
And I think at least one animal study looked at different substances and how much they raised dopamine level. And chocolate clearly had an effect, as did cocaine and drugs like amphetamine. But the chocolate effect was a much milder effect. I think it raised levels by about 55%, whereas I think the amphetamine was 1,000%.
Yeah, so these were studies done in rodents, rats, and mice, essentially to measure dopamine levels in response to these different signals, and found that, yes, chocolate is reinforcing for rodents, amphetamine is more reinforcing. That also maps onto the behavioral paradigms for measuring addiction, which are basically how hard is the organism willing to work to get the drug. A rat will press a lever for chocolate, but probably not till exhaustion or death. Whereas a rat given access to amphetamine or cocaine, for example, and given unlimited exposure to that lever to receive intravenous cocaine or amphetamine, will essentially press that lever until it dies. It is important, though, to keep in mind that some of the dopamine measurements are artifactual based on how the drug works in the brain. So cocaine and amphetamine, their mechanism of action is to directly increase dopamine within the synapse. That's how they work. Whereas something like chocolate is a much more complex chemical cascade involving probably, endogenous opioids and other appetitive food-related centers, and then eventually releases dopamine. So it's not all just that cocaine and amphetamine are so much more addictive than chocolate based on dopamine measurements, because, again, some of it is mechanism of action. The other thing that those experiments don't capture, which is really important, especially when you translate them to human beings, is what we call drug of choice, which is to say what releases a lot of dopamine in your brain's reward pathway may not release a lot of dopamine in my brain's reward pathway, and vice versa. So we are complex creatures. There's enormous inter-individual differences. Alcohol does absolutely nothing for me, but give me a romance novel or a TikTok video, and I'm off and running. And so I think really recognizing this drug of choice phenomenon is important. Again, when we look at modernity and the epidemiology of addiction, what we have today is not just more access to traditional drugs, but also drugs that never existed before: online pornography, social media, online video games, a wealth of financial investment types of potential drugs, online sports betting. So we are now living in an environment where we have so much more access to these novel drugs that even if you're a person who is relatively resistant to addiction to traditional drugs, there's probably a drug out there that you wouldn't be invulnerable to.
Because we're basically overloaded with dopamine stimuli, whether that be food, gambling, whatever it happened to be.
Yes.
And when you say, Anna, we respond to these things differently, is that because dopamine is linked with our centers of pleasure? So, for example, for me, a romance novel wouldn't be particularly interesting. So therefore, because it doesn't give me great pleasure, that's not going to push up my dopamine levels.
That's right. Sometimes people say, well, I thought dopamine wasn't about pleasure. It was about motivation. And my response to that is it's about both pleasure and motivation. In order for something to motivate us, it has to initially be pleasurable for us, right? Which means that at first exposure or early on in our career with that particular substance or behavior, it has to make us feel good. Otherwise, we wouldn't be motivated to repeat the behavior. So for me, romance novels are a great escape. Novels in general are a great escape. I won't ask you what your drug of choice is, but it's clearly not that, but it's probably something else.
I love going to the theatre. I really enjoy drawing and watching tennis. But obviously all of those things I could spend a lot of time doing when I could be doing perhaps something else more valuable.
Right. And all of those sound kind of healthy, right? Is it going to the theater? It's like you're with other people, you're supporting the arts. Drawing is a great creative endeavor, which is also effortful. So your rewards are delayed, which is typically makes them more resistant to addiction. Watching tennis is the one where I could imagine you could get lost in, let's say, lots and lots of tennis videos and end up with, opportunity costs, other things that you might be doing if you weren't spending hypothetically hours per day on some days watching tennis videos. So, it can be very subtle. It's a range.
But when it comes to, say, food addiction, if we have someone who has a propensity for that addiction, perhaps 100 years ago, they wouldn't have had the same access to the types of food, and certainly ultra-processed food wasn't around in the same way. So they might never have developed a food addiction, whereas what you're arguing now is, because of the environment they find themselves in, they're therefore more likely to develop that addiction.
Yes, exactly. And what I find striking about food addiction is a little bit like alcohol addiction. It's something that I think is highly heritable or highly genetic. So just even like looking among my own kids, I had one child who would moan with pleasure when I was nursing her. I mean, just feeding for her was just absolute ecstasy. And although she doesn't have a food addiction, she, as a child, like cakes and the chips and the candy, that was obviously very early on a big focus for her. And I have other children for whom it was like, take it or leave it. My other child's like, when he was done getting the amount of milk he needed, he actually disengaged himself and crawled away. So, very different kinds of early sort of interest in certain things. And I think many people with food addiction will tell you that even in childhood, there was this sort of very early recognition of a kind of love of eating and early appetitive control issues when it came to things like sweets and cake and other things that we know are very reinforcing for the mammalian brain.
So if I decide I want to eat a box of chocolates, can you talk me through how that will affect my dopamine levels?
Well, again, it sort of depends if you're somebody who's vulnerable.
Okay, I do like chocolate. I don't think I've got an addiction, but I definitely do like chocolate, yeah.
You do like chocolate. Okay. So if you like chocolate, then what happens when you eat a piece of chocolate, or maybe even when you think about eating a piece of chocolate, since you've already had chocolate and your brain knows that you like chocolate and remembers that, when you think about eating a piece of chocolate or you eat a piece of chocolate, you get temporary increase in dopamine firing, and that feels good. But no sooner has that happened than the brain's going to adapt to those increased dopamine levels by downregulating your own dopamine transmission. And that will bring your dopamine firing back down to baseline, or possibly even slightly below baseline in a kind of mini dopamine deficit state before going back down to the baseline position. In that moment, right after you eat a piece of chocolate, and it probably correlates with those lower dopamine levels, you may have a very intense desire to have another piece of chocolate, even though you told yourself you would just have one piece, or you should only have one piece. And if you resist that urge, then your dopamine levels will go back up to baseline, and the craving will probably abate, and the thoughts about the chocolate will go away, and you will go on to the next thing and only have eaten one. But if you continue to consume chocolate, especially over days to weeks to months to years, what ends up happening is that initial upward deflection when you eat a piece of chocolate gets lower and shorter in duration, but that after response, that dopamine deficit state gets stronger and longer. And ultimately, you can end up in a kind of chronic dopamine deficit state. And now you've entered addicted brain, where now you need to eat chocolate every day, not to feel good and get pleasure, but just to bring your dopamine levels back up to baseline and feel normal. And when you're not eating chocolate, you are in a state of subthreshold or full withdrawal. And the universal symptoms of withdrawal from any addictive substance are anxiety, irritability, insomnia, dysphoria, and craving, which often manifests as mental preoccupation with getting the drug, using the drug, hiding drug use, as well as intrusive thoughts and images of the drug, as well as complex narratives around why you should consume the drug, even though you made a commitment to try to cut back or stop using the drug. And our brain is incredibly good at coming up with these really convoluted narratives that allow us to rationalize this self-destructive behavior.
So I often think the second chocolate is actually the best chocolate, and it's diminishing returns after that. And this problem with increased tolerance is because our bodies are trying to keep our dopamine levels in balance, basically.
Yeah, I mean, our brains were evolved for a world of scarcity in which we actually go into a kind of a pain state as we get hungry, as we get thirsty, as we get tired. That pain state then motivates us to seek out these rewards that we need for survival. And when we find them, we ingest them and we return to a kind of baseline level. That's called homeostasis. And all living organisms want to return to homeostasis. It's one of the fundamental laws of living organisms in nature. So the way that in like primitive times we would get out of balance is that we would be in some kind of state of pain and need to get the reward to bring ourselves in balance. We are living in opposite conditions now where without having to do any work, we are getting out of balance by ingesting these highly reinforcing substances and behaviors at high volumes with minimal work required, releasing a lot of dopamine all at once. And then our brains are really kind of reeling to compensate and doing so by temporarily changing our baseline, our tonic baseline, to a lower dopamine level.
So our dopamine will be released in response to a conditioned cue, which could be me just thinking about having a piece of chocolate, but then it drops slightly to encourage me to go and get that piece of chocolate.
Yes. So when you ingest, your drug of choice, it's typically followed by a compensatory dopamine deficit state, going back then to baseline, assuming that you don't continue to consume. But we also know that even just thinking about getting your drug of choice, in your case, chocolate, can cause a little mini dopamine spike, followed by a little mini dopamine deficit state, which sets up the craving that makes us want to do the work to go get the drug itself. And I think one of the most universal examples here is when our smartphone dings or buzzes in our pocket. That acts as a cue, a conditioned reinforcer, where although we told ourselves we were going to pay attention to whatever was happening in real time and not look at our phone, we get a little spike of dopamine followed by a little mini dopamine deficit state. Now we're in a state of craving, thinking, okay, just quick look at my phone. I'll just see what came in. It's all about, anticipating some kind of reward through the digital device.
I mean, I actually have most of my settings on my phone set to silent, but it's not a pleasurable thing picking up an email on my phone. It's just a work thing or something you might have to do, but it's not giving you, well, certainly for me anyway, it's not giving me a particular sense of pleasure.
So dopamine is also very sensitive to novelty or anything that's new in the environment or anything that suggests there might be something new in the environment worth exploring. And that's why, although, the notification alerting us to a text or an email or what have you might not necessarily lead us to something that gives us pleasure, it's information. It's a package to be unwrapped. It engages our treasure-seeking function. And then we are compelled by the same dopamine cycle to go and unwrap that package and see what came in.
And I was interested to see in your book, you say that dopamine can play a bigger role in the motivation of getting the reward rather than the reward itself. And I wondered if you could talk about the experiment with healthy controls and gamblers in terms of their dopamine response to gambling.
Yeah. So I think, again, it's important to emphasize that it's both pleasure and the reward itself and the motivation to get the reward. And it really depends on the different stages of exposure. So initially, there has to be some pleasure associated with the substance or behaviors. But over time, as our brains accommodate and adapt to that reinforcer, now it's really mostly about motivation kind of getting out of that dopamine deficit state. And very often people with severe addiction will report that there's almost no pleasure in their addictive behaviors, and yet they still can't stop. They're caught in that vortex.
The initial pleasure that spurred them on has gone.
Right. And now the motivation essentially comes out of trying to get out of that dysphoric state and feel normal again. So with gambling, there are interesting studies showing that if you compare pathological gamblers, that is to say, people who are addicted to gambling, and recreational gamblers, and you measure dopamine levels in their brains as they're gambling, what you find is that both pathological gamblers and recreational gamblers will have an increase in dopamine in the reward pathway when they win, as you would expect. But the difference is that for pathological gamblers, they will have that spike even when they lose, which is interesting because it suggests that it's not the monetary reward itself that is driving the activity, the pathological engagement or compulsive consumption. It's something about just being in the game state, which allows them to escape reality, numb themselves, not think about other things, be in the flow of gambling. And that the highest release of dopamine in pathological gamblers occurs when the odds of winning and the odds of losing are equal. So being in that state of optimal uncertainty about the outcome is a state of probably maximal dopamine release because of the pleasure of not knowing what is going to happen next.
It's an addiction to the process, not because they want to particularly win the money.
Yes. I mean, nominally, they want to win the money, but there's a concept called loss chasing where when they're losing, they're also on some unconscious level happy about it because then it allows them to rationalize staying longer in the game to win it back. Because, of course, it's the game itself and the flow state they get into while immersed in the game that is the drug, rather than the money itself being the drug.
And you say that deaths from addiction have risen in all age groups between 1990 and 2017. Would that include food addiction too?
That's a good question. I don't know the answer to that. I mean, if you're counting obesity as a sequelae of food addiction, which I think some people who are obese have food addiction, but some people who are obese do not have a food addiction. Addiction, importantly, again, is this complex biopsychosocial behavior combined with things like physiologic changes and brain changes. But what we do know is that for the first time in human history, there are more people on the planet struggling with obesity than who are underweight. And that is unprecedented in human history. If you look at the top causes of death, the top 3 causes of death worldwide are due to drug use, obesity, and its health sequelae, and the sedentary nature of our lives, which then lead to all other kinds of problems, cardiac disease, diabetes, etc. So I think that's a proxy.
So if we're living in this world where we've got this overabundance and our dopamine levels are being stimulated all the time, what happens long term if we have unhealthy levels of dopamine? What's the long-term impact on our brains?
Well, essentially what happens long term is that we change our hedonic or joy set point such that we need more pleasure in more potent forms to feel any pleasure at all. And our baseline state is a state of displeasure, pain, discontentment, anxiety, irritability, depression, insomnia. One of the things that I've argued is it's clear that we are seeing rising rates of depression, anxiety all over the world. In North America, including the United States, we're seeing rising suicides, which is completely tragic and horrific. It's a complex problem. There's lots of explanatory models. But one of the things that I've proposed is that perhaps it is abundance itself and the changes that the drugification of everyday life is causing on our brains that may be leading to this physiologic state of depression, anxiety, also physical pain. We have higher rates of youth endorsing physical pain than ever before, even in the absence of any identifiable physical injury or disease process to explain that pain. So again, my thought is that it is overabundance itself, which is causing this aberrant physiology leading to these states of despair.
And as you mentioned, we've got rising levels of depression. Is that linked to the fact that in the US and a number of other European countries, reported levels of self-happiness are lower?
Yeah. So, life satisfaction surveys or happiness surveys have been conducted for at least the past 50 years. And typically, as countries grow wealthier, happiness reports get better. People get happier. But about 20 years ago, something shifted. And the wealthiest nations in the world over the past 20 years have been reporting that their citizens are less and less happy, that they're less and less satisfied with their lives, less and less hopeful about the future. And that's really kind of a paradox because we have more than ever before. We also have more access in these countries to mental health treatment. We're prescribing more psychotropics, which are supposed to solve that problem.
Well, some people might argue that some of the psychotropic drugs are causing problems in themselves.
Oh, absolutely. And I would join them in that. But nonetheless, if the a priori argument is that the problem is that we don't have good access to mental health treatment, that's a difficult argument to defend when you see that as access to the mental health treatment we have has increased, people have actually gotten less and less happy and also more and more depressed and anxious, and at least in the United States, are more likely to end their own lives.
So you've suggested that someone with an unhealthy dopamine balance in their brain can potentially go on a dopamine fast to try to reset the system.
Yeah. So 20 years ago, if someone came into my office and reported that they were feeling anxious and depressed and wanted help, the first thing I would have done was recommend a course of psychotherapy and or prescribe an antidepressant. Today, the first thing that I do is screen them for their behaviors and their consumption of food and drugs. And if I detect there that there's a problem of overconsumption, including of digital media, the first thing that I will do is recommend a dopamine fast or an abstinence trial for 4 weeks of not using their drug of choice. And the reason that I do that is because there are data to support that as an intervention, and I'll share it with you in a second. But also what I have seen with people who get addicted to drugs and alcohol, who often are depressed and anxious and unable to sleep, etc. Once they are able to stop their drug of choice for 4 weeks, they feel remarkably better. When we're withdrawing from things like sugar, people can have, the psychological symptoms of withdrawal that I mentioned, anxiety, irritability, depression, insomnia, etc. But also they can have physiologic withdrawal, actually sweating, shakes, lightheadedness, stomach cramping. It is remarkable how physical it can be for some people. But then as our brain begins to get the message that we're no longer getting this particular reward, and it begins to upregulate dopamine levels and other key neurotransmitters. Usually by about week 3 or 4, people start to feel better, actually better than they have in a really long time. And in many instances have a complete resolution of their symptoms of depression and anxiety. So I've now extrapolated that to all kinds of behaviors as well, including digital media, and seeing clinically that when we get in there and change that consumptive pattern, that people very often, the majority, will come back 4 weeks later feeling much better without our having done any other intervention. Also, there's an experiment by Brown and Schuckett, now a very old experiment, but an important one, showing that if you take a cohort of adult males who meet criteria for alcohol use disorder or alcoholism and also major depressive disorder, and you put them in a psychiatric hospital for 1 month where they have no access to alcohol, but also do not get any treatment for depression. So no medications, no psychotherapy, no groups. They're just sort of warehoused for 4 weeks. What you'll find is that at the end of those 4 weeks, 80% of those individuals no longer meets criteria for major depression. So simply by stopping drinking, depression symptoms have resolved in 80% of those individuals. That's a compelling piece of data. It's consistent with my own clinical experience. And it's consistent with the dopamine hypothesis that says that repeated exposure of our brains to highly reinforcing substances and behaviors changes our hedonic set point and can really cause these states of mental distress, anxiety, depression, inattention, insomnia.
Now, let's say I've got a food addiction. I do this for a month and I reset my body. The problem with food addiction is, unlike alcohol or cocaine, I can't stop eating food. I've just got to have a more sort of normal behavior towards it, which is a slightly different thing, isn't it?
It does add to the complexity of food addiction. And I think a reasonable analogy is digital media and digital devices, because they're so deeply incorporated into everyday life and people need to do them for their jobs and school. It's hard to say, well, just don't go on a screen for a month. But what you can do with a food addiction is you can abstain from sugar for 4 weeks, or sugar plus any ultra-processed food for 4 weeks. If you're a person who regularly eats sugar in your daily diet, even in moderation, and you try to cut it out, it's remarkably difficult. When we talk about dopamine fasting with food addiction, that's what we would do. We would identify the problematic foods, the foods that once I start eating, I can't stop, foods I repeatedly binge on, foods that make me feel sick, or whatever the parameter is. And we would suggest trying to eliminate that for 4 weeks.
And I suppose the problem with, for example, weight loss surgery is it doesn't address the underlying behaviors.
That is indeed the problem with many of those types of interventions. And in fact, about a quarter of individuals who get some kind of gastric bypass surgery will go on to develop another addiction, a cross addiction. Often it's alcohol use disorder, because what happens with the rerouting of the intestine is that it makes it very easy to very quickly absorb the alcohol, and then it makes alcohol more potent. So we are seeing that about a quarter of folks who get some kind of gastric bypass surgery for obesity end up with an alcohol problem or other kind of compulsive overconsumption problem, which is why it's so important in the context of those surgeries to also address the behaviors more broadly.
I guess with those surgeries, that's potentially two issues. Somebody who perhaps has a slightly addictive personality and the surgery, which will then heighten the impact of alcohol.
That's right. Yes, two things going on, exactly.
So how would you like to see clinicians today using our knowledge of dopamine in the treatment of patients with food addiction?
I'd really like them to explain to people that their appetitive control problems when it comes to food is at least in part because the food itself is addictive, and it's been engineered to be so, and it works on our brain not just by fulfilling nutritional requirements, but actually it works on the same reward pathway as drugs and alcohol. And ultimately, our brain can be hijacked by the rewarding aspects far beyond any potential benefit and even into an obviously harming state. I think that's important because it allows people to have compassion for themselves and realize, oh, wow, it's like the food supply is really conspiring against me. And it also is empowering because what it says is, if you're eating foods as nature made them, you probably will have a lot easier time controlling or managing or moderating your consumption because you won't get into that dopamine-driven hedonic treadmill.
And I'm interested, Anna, when you discuss these ideas with your colleagues, do you find a sympathy for them or skepticism?
There's more and more interest in psychiatry in using what I'll call diet, which is a loaded word, or using certain nutritional approaches to target mental illness. So, for example, I have a colleague here who's working on the ketogenic diet as a way specifically to treat anxiety, to treat depression. So that's interesting because it suggests a sort of higher respect for what our food supply can do, good or bad, when it comes to both physical and mental health. I think we've been very focused on obesity and weight, but there are all kinds of other ways that the way that we eat can impact our well-being and our physical well-being.
Do you think there's a difference in terms of attitudes in the US and the UK on this?
Gosh, I don't know. Maybe you can tell me. I'd be curious.
If I look at the speakers at the food addiction conference, there's one British speaker, every other speaker is American. Which would suggest that there's a greater interest currently in the US than the UK, I would say.
Yeah, it could be driven by the fact that the US has a very serious obesity epidemic. And this is something that I think we're very aware of here. And it's just of such proportion that there's really a lot of sounding the alarm. What can we do to help people eat healthier? And again, I think one of the major things to recognize is that, well, it's very hard in an environment where you're constantly being proffered unhealthy choices.
My weight's pretty stable, but I used to spend a couple of months a year working in the States, and I was just conscious of how there was more sugar added to everything.
Yeah, right, exactly. And also just more of everything, right? I know many times Europeans will come here and they can't believe the size of the portions. And
Oh, yeah, business meals were terrible. What I had to do was have a starter and one other course because there was absolutely no way I could possibly have eaten a 3-course US meal.
Yeah. And it's interesting to just extrapolate that and look at the fascination, not just in the United States, but certainly prominently in the United States with these kinds of binge eating videos where people will go and try to eat as much food as humanly possible in the shortest amount of time, and kind of a glorified thing. At the same time that people are very concerned with their weight here, wanting to be thin, perhaps too thin. So unfortunately, we don't really have a healthy relationship with food and with our bodies in many instances.
Well, Anna, thank you so much for talking today. Such an interesting subject.
Thank you so much. It was my pleasure. I thought it was great questions, and thanks for giving me the time to elaborate.
Many thanks, Anna. Great talking to you. Goodbye. Hope you enjoyed the latest episode of the podcast. And if you've enjoyed the show, if you could leave a review, that would be much appreciated. It really helps. Many thanks for listening. Bye for now.